Okay, chapter 9 is over admissions, transfers, and discharges. So an admission is basically the official entry of a person into a nursing center. New residents and families may have concerns and fears. Hopefully, they have been to see the facility prior to admission to the facility, so they kind of know what things are going on. But they still are going to have concerns and fears. Again, remember this is a major adjustment for the resident and the families too, because a lot of families come into the center thinking that they're going to have this one-on-one person, and it doesn't work that way. Um, so sometimes their expectations aren't realistic, and so we do the facilities really do try to be realistic with the families, but sometimes it takes a little, again, a little adjustment period. A transfer means moving the person either to another healthcare setting. um, Maybe they went from or maybe they came home to the long-term facility, but then they moved from one unit to another unit, or maybe to another agency. Maybe maybe their family moved, and they're going to move them to where they're going. So that's a transfer, like from one nursing home to another nursing home. Or maybe they're just going to the emergency room. That should be a transfer too. All these are similar because they don't actually leave now I shouldn't say that. They don't actually leave the facility forever. They're just going to a place and they're going to return. That's a transfer. But a transfer within the building, you're moving maybe they started off in 102 and then they moved to 206, that's a transfer within the facility itself. I think that's probably explains it a little bit better. Discharge, that is the official departure of a person from a nursing center. It's usually a happy time, but the person still might have to have home care. So just like, and a lot of people go to nursing homes, the older adults go to nursing homes like for rehabilitation, because nursing centers are often really trying to specialize in certain areas, and rehab is one. And so what they would do is the person broke their hip. They go to the hospital. They're only there at the hospital maybe 2 to 3 days. Then they go to a nursing center. It might be a rehab center, or it might be a long-term care facility, and they're there for physical therapy or occupational therapy, depending on what they broke. But I said hip, so we're going to say physical. So they go there for their PT. Well, they make progress with their physical therapy. Then they get to a point that they're going to go back home. They're independent enough to get back home, but they're still going to need physical therapy. When they go back home, this is then where home health would pick up. And then they can continue that physical therapy. It won't be on an everyday basis, but it might be, 3 or 4 times a week for 2 or 3 weeks, and then it will keep decrease till the person is back up to either baseline or optimal functional level. And OBRA has standards for transfers and discharge, and always the person's rights have to be protected. So when you're admitting or transferring or discharging a resident, of course, privacy and confidentiality has to be maintained. Reporting and recording is essential depending on what you're going to be doing. No matter who, you're always reporting to somebody, no matter if it's an admission, a transfer, or a discharge. If it's an admission, the person who is admitting them is then going to report that information to the RN, who's going to then start the MDS process. If you're transferring, the nurse has to report the condition of the patient to the facility, or to the unit or the facility that is getting the patient, or I'm sorry, the resident. And then if they're discharging, then sometimes, usually, we do have home health come in, and so that has to be reported, or you're reporting off to the doctor. So, there's always reporting, and there's always documentation that has to be done. So understanding and communicating with the person and the family is all important here in this process. And then, of course, with the health team, and then respecting that person's birthday. And of course, always be kind, courteous, and respectful. No matter to the grumpiest patient, a kind word does wonders. Even if they don't look like they appreciate it, it does. It matters. So let's see. Sure. Um, all right. Now, during the admission, of course, we get all the identifying information is obtained from the person and or the family. The room assignment's made, the nurse or the social worker, sometimes both, explains the resident's rights to the person, and then the person or the legal representative will then sign the admitting papers and a general consent for treatment. Because anytime you go into a facility, like whether it's a hospital or a long-term care facility, you have to give a general consent for treatment. So everything has to, they're informed, and then they have to agree that we can actually treat them, or there's no reason for them to be there. The person's photo is taken, and then they receive an ID bracelet. And residents arrive by ambulance, wheelchair, van, wheelchair, or I'm sorry, wheelchair van, or the car. Um, and basically, the goal is to make it simple and easy. And so sometimes the submission process starts 2 to 3 days before the person actually enters the center, so that we can have as much information as possible and make that transition as easy as we can. Identifying information obtained should include their full name, their age, their birth date, and the doctor's name, the Medicare number, and their religion. And usually that's all on that first face sheet on the chart, so that, we can't remember everything. So, that's why you have a chart to go and look at. The nurse or the admission coordinator usually obtains all these needed signatures, and the residents, not only do we tell them about their rights, but they also receive it in writing as well. Most everything has a copy to it, and all that goes to the a person, to the significant other, the family, or the patient. So it's kind of a, if you ever saw one, it's a lengthy process, but necessary. So again, it can be a hard time for the person and the family, and I'm telling you, sometimes I've had residents come who were not happy to come to the long-term care facility. They didn't want to come, but they had to come. This was a family decision, and sometimes, and I've had people tell me they made me come here. There's nothing I can do about that. I just try to make them as happy as possible when in the facility. But I'm telling you, they need the extra length of time for adjustment, because they don't always do very well. Sometimes never, and sometimes eventually they'll adjust to it. And sometimes they find that they actually like it instead. But in the beginning, that was not so. So persons with dementia and their families may need extra help too, because a person with dementia, we try to their day routine, to get them, depending on the severity of the dementia, we keep that routine as consistent as possible. Well, they've done that at home too. The person who's been taking care of them, they got up at 8 o'clock and we had breakfast at 9, and then I set him in the chair and he watches this for a while. Then we get up and we have lunch, you know, going through through their process of the day. Well, when you take them out of their routine, what happens is their confusion increases. It doesn't go away. It actually gets worse because they're in a whole new setting. They're now out of their familiar area and their familiar routine, and so their confusion increases, and they can get fearful, they get agitated, they want to leave. All those are common things that happen, especially with the person who has dementia. The families also feel fearful, and they can feel guilty because they had to bring them here. So there's dynamics going on basically. So as far as your role goes, you're going to prepare the room before the person arrives. You're going to greet them and escort the person to their room. A nurse usually does it, but you may be there too, and because they're going to introduce you is what they're going to do, and say this is your aide, and then you introduce yourself, and you're the one's going to be in there helping them put their things away and all this other stuff and showing them around. And we we do give them information overload, just like on the first day of class. It's all information overload in the beginning, but then we keep reinforcing different things, and it gets better with time. So admission really is your first chance to make a good impression. So greet the person by name and title. Introduce yourself by name and title. If you want to call them by their first name, and you need to ask them, is it okay to call you Jane? And that's their name, and they say yes, wonderful. If they say no, then you call them by what they want to be called. Like, my name's Kimberly, but if you ask me, do I want to be called by Kimberly, I would tell you no, just call me Kim. So, it's whatever their name they go by. Make roommate introductions for them. Always act in a professional manner and treat the person with dignity and respect. Help meet their safety and security needs. Number one, don't rush them. They never, we really never need to rush the residents. And some of them just can't do it. Even if you try, you're just going to make yourself agitated and they're going to be agitated too because they can't do it. So you might as well just take a chill pill, few deep breaths, and then don't rush them and then go with the flow. So treat the person and families as guests in your home. Introduce them to the roommate and residents nearby rooms. You have to tell them this is where your closet is. This is where the bathroom is. This will call me. Turns the light on for me to come in and visit. See what you need, and you just make the room as home-like as possible. Help them set up their pictures and stuff like that, and just show caring. That's showing caring and compassion. And when you rush someone, it's like you don't have time for them. Basically, is what you're saying. I don't have time for you, so hurry up. And we don't want to do that. You really don't. You wouldn't like that being done to you, and we don't want to do that to others. So during the admission process, you might have to collect some information for the admission form. And mainly, a lot of this is like that inventory list I've mentioned before, like how many gowns did they bring, how many socks did they bring, how many pieces of underwear, how many gowns, and so forth. You're probably going to measure their weight and their height. That is one of the things that you usually get, as well as the vital signs. Now, the nurse might take the vital signs. It depends on what the facility policy is and what they want. But you might be asked to do it. Complete a clothing and personal belongings list, and then orient that person to the room, the nursing unit, and the center. The weight and height are then measured on the admission, and then again, however it's designated by the care plan, whether it's daily, weekly, or monthly. All right. And then in transferring or moving the person to a new room, we have to explain the reasons for the transfer. It might be because the person's condition changes and where they are, they can't take care of them. They don't have the staff or um, whatever to take care of them. Maybe they're not the skilled portion of the center. Okay, so they might have to move to where the skilled portion of the center is. The person requests a room change. Maybe they don't like the roommate and they don't like where they're at and they want another room. Roommates don't get along. Sometimes that does occur. Person's care needs change, or they need to be closer to the nurse's station for closer supervision. So the doctor, social worker will explain the reasons for the transfer, and then basically your role is to assist with the transfer and perform the entire procedure. It depends on the facility. A lots of times it is you who is doing the transfer. Um, so that means you have to get all their belongings together, move it to the new room. You have to do a little reorientation of the patient to the room again, introduce them to the roommate if they have one, and things like that. So basically, you want to support and reassure the person, and then you communication skills. Let's see here. Often, the family and the business office are told about the transfer. Sometimes it's a family request for the transfer, and the nurse will tell you transfer procedure, so you don't have to guess at it because good Lord, y'all will know probably things before the nurse does sometimes. So, if they want a new room, you already kind of know because the family's already they may discuss it with you or try it with you because they ask the information from everyone. Yeah, and residents are really good about fishing for information. I'll let you know that. So you have to be careful what you tell them. Um, so they're very good fishermen, women. Transfers and discharge, OBRA and CMNS have standards, and basically is to protect the patient's rights. And the reason for the move are part of the medical record because it has to be explained while we're transferring a patient from room to room. It can't be for our convenience. The person and the family are informed in advance, and then there's a procedure that has to be followed, especially if the person objects. And also an ombudsman uh, may be called in or at least notified of the transfer to protect the person's interest. Reasons for transfer and discharge. If the move is necessary to meet the person's welfare, it can't be met in the center. If it can't be met in the center, they have to move to somewhere where it can be met. If the person's health improved so that the center services are no longer needed, they can be discharged or transferred to another facility. Health and safety of other people in the nursing center are in danger. So if I have a patient who completely goes into horrible behaviors, we've tried everything that we can, they are endangering themselves or others, we've gone through this process, maybe they have they're not taking, they refuse to take their meds, and maybe they have bipolar disease or some other mental processes going on that makes them a danger to others. Then the facility can discharge them because we can't keep them in there. Remember, it's a community setting, so everybody has to be safe. So if you've got someone who's not being cooperative, who's endangering others or themselves, then we have to do something about it. If the person has failed to pay for his or her stay in the nursing center for whatever reason, they can discharge them. Now, they do have to give them notice, but they will discharge them. And then, of course, if the nursing center closes for any reason. When they do discharge, this is the official departure of the person from the center. The health team has to plan for the discharge. They teach the person, the family about their diet, their exercise, and drugs. We teach them about any procedures and treatments that are needed at home or that need to be continued. We will arrange for home care equipment and therapies as needed, so that helps out the family. We will make a doctor's appointment for them if that's necessary. Sometimes the families do because the families have to work around their own schedules in order to take them to the doctor. So in the process, you're always talking to either the person who's leaving or and the family who's going to be taking care of them, who is their support system after their discharge. So again, good communication skills are needed when assisting with the discharge. You want to wish the person and family well as they leave the center, even if they were the most demanding people in the world. And because you will meet people like that. They're all not going to be all, sweet Mother Hubbard. They're just not. They're people. So you meet and you see them sometimes at their very worst, and sometimes they're so kind and generous, and you would just love to hug them and squeeze them. They're so sweet. But so you see the whole spectrum is what I'm trying to tell you. So don't be surprised if you have someone who is extremely demanding and hateful, and the other extreme, the sweet, and everybody else is in the in between. So if a person may want to leave the center without the doctor's permission, and they can do that. It's called AMA, against medical advice, but the nurse has to. We have to explain to the person basically what AMA is. Um, so you would want to tell the nurse at once if the person says, I'm leaving, I don't care what the doctor says. you know you would tell the nurse at once, and that they've expressed the wish and the intent to leave. And these are alert and oriented people, even dementia patients too, but we try to get the families involved in all that. So we would call the families, we would talk to the patient, and if they leave, which is their choice, they're in the right, then we just notify all the appropriate people because you can imprison somebody. Now, quality of life, basically we want to help the person and the family. We want to be courteous, caring, efficient, competent, sensitive to fears and concerns, handle their property and valuables carefully, respect, and make sure everything that can be um, have their name on it, make sure it's done. Treat the family and a person you want your own loved ones treated. And you have to visit your new residents often because, we want them to feel welcome. We don't want them just to get there, oh, everybody was nice that first day, and then nobody ever came back to see them again. And then again, explain everything to them, what the various sounds mean, what and times that, um, different times that we do things and make a lot of noise so that they know what's going on. And of course, always protect the person's rights and promote quality of life. So this ends chapter 29, and I will see you guys at the next class.